Good afternoon, ladies and gentlemen. Welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to your moderator, Geneviève Martin, Senior Improvement Lead at the Canadian Foundation for Healthcare Improvement. Please go ahead.
Thank you. Hello, everybody, and welcome to today's extra Cohort 16 information webinar. As said, I'm Geneviève Martin, Senior Improvement Lead at the Canadian Foundation for Healthcare Improvement, and pleased to be hosting today. During the webinar today, we'll be sharing information about the 2020-2021 extra program, and we'll be answering any questions you have and also the questions you submitted when you registered. We're pleased to see that we have participants from coast to coast with us today. So before we begin, I'd like to acknowledge that the CFHI office where this webinar is being hosted are located on the unceded territory of the Algonquin First Nation. As I introduce our speakers, please take a moment to introduce yourselves using the chat box on your screen. Please also take a moment to let us know how many people are attending from your location, including yourself. So who's on today's call? Patty, we're pleased to have a member of our faculty and an extra fellow join us on the call today. Patty O'Connor is Extra's Curriculum and Faculty Coordinator. Patty works as an independent consultant and is also an assistant professor for the Ingram School of Nursing at McGill University. She has over 40 years experience in healthcare, including 13 at the executive level. As a former Chief Nursing Officer at the McGill University Health Center, she led innovations in partnering with patients and frontline staff to co-design improvements in care delivery, recognized as leading practices by Accreditation Canada. Patty holds a Master's of Science in Nursing, is a certified health executive, and has completed fellowships with CFHI's extra program. She was part of the first cohort, the U.S. Commonwealth Fund Harkness program, and the Canadian College of Health Leaders. Also with us is Courtney Bean, Director of Client Services at VHA Home Health Care. Courtney is currently participating as an extra fellow in Cohort 15 with his team from Michael Garron Hospital, VH Home Healthcare, and Wood Green Community Services. In the studio with me at CFHI in Ottawa, we have our producers, Kelly and Mihaela, and also from the extra team, Jessica Fournier, who will be helping moderate the chat. So for today, the objective of the session is to learn more about the extra program, the objectives, the key activities, and the deliverables. We will hear from a participant, a current fellow, on his experience in the program. You'll also hear from our academic coordinator about the curriculum, the faculty, and the coaches. And you'll getting some perspective on assessing your organization's readiness to lead improvement and join the extra program. So a bit about the Canadian Foundation for Healthcare Improvement and the extra program. So for those who may not be familiar with CFHI, we are a not-for-profit healthcare improvement organization funded by Health Canada, and we're dedicated to accelerating healthcare improvement. Our refreshed corporate strategy focuses on making change happen by delivering more improvement for more people and making that improvement last. We continue to work shoulder to shoulder with our partners to accelerate the identification, the spread, and scale of proven healthcare innovations with an emphasis on delivering better care closer to homes and community. Our strategy was co-created in consultation with our staff and stakeholders across Canada. We're looking forward to advancing shared federal, provincial, territorial health priorities with our fellow Pan-Canadian Healthcare Organization and other partners. So CFHI's goals are to find and promote innovators and innovations, drive rapid adoption of proven innovations, enable improvement-oriented systems, and shape the future of healthcare. So one way to achieve our goals is by offering the EXTRA program. So a bit about EXTRA. EXTRA is a 16-month pan-Canadian quality improvement and leadership fellowship. So the program offers the opportunity to co-design and implement, evaluate an improvement project that's aligned with your organization, your regional, provincial, or territorial strategic priorities. And it's not only an investment in individuals, the program builds leadership and organizational capacity to achieve improvement that enhances care and experience for patients, families, and healthcare provider, and improves value for money, so the quadruple aim. So there are benefits for the individual fellow. So by joining EXTRA, you enhance the leadership skill. You join a pan-Canadian alumni network that is now composed of over 450 senior leaders. You're recognized as a graduate of a leader program that is now over 15 years running. You receive hands-on coaching and guidance from expert faculty and coaches, and we'll explain that a bit more in detail soon. You'll gain access to the full EXTRA program offerings that are subsidized by CFHI. The organization also benefits by developing these leaders that have expertise to transform care and the ability to convert the evidence into actionable policies and programs. And basically seeing the fellows, you share your learnings within the organization and across the system. So over the years, EXTRA's impact, as we mentioned, has been running 15 years. We are now, the call for application is for Cohort 16. There have been 156 Canadian organizations that have participated, and we're at 455 healthcare professionals. And we have supported 243 improvement projects. So who should apply? So you should look for a minimum of 3 and maximum of 4 fellows that are required to participate as the core team. And a fellow must have significant scope of responsibility and influence within the organization. Your team can be drawn from healthcare professionals, but also in social service sector. And it can involve a service delivery institution, a healthcare organization, a health authority, but also ministry. And the team can include providers, administrators, and patients or people with lived experience. So examples of participating organizations, it could be a hospital, could be a regional health authority, primary health care, public health, community and not-for-profit organizations, social services organization, Indigenous health organization, ministries. So the EXTRA, this is them showing the program timeline, and we'll go again a bit more into detail into the program with Patty. But as you can see, the deadline to apply is coming up in February 2020, and the teams would be notified at the end of March, early April 2020, whether they participate. The program has 4 modules, and the module 1 being in Ottawa in June 2020, the second module in August in St. John, New Brunswick. And the third module includes a site visit to your organization by CFHI staff and your coach, and also some webinars. And there's work doing the QI project during that time. Module 4, there's an error on the slide, apologies. The Module 4 occurs in February. And we haven't determined where this will be as of yet. And then the final presentations are in June of 2021, and the final report is due in August. So that gives a bit of an idea of the program, and I will now pass on let Patty O'Connor, our curriculum and faculty coordinator, tell you more about the curriculum and give you a bit of detail. So Patty, over to you.
Thanks very much, Genevieve. Good afternoon, everyone. I'm delighted to be able to tell you about a little bit more about the EXTRA program, which, by the way, is the only bilingual executive training program provided anywhere in Canada. And as Genevieve mentioned, I was in the first cohort. One tool that CFHI uses across our programming is the 6 Levers for Accelerating Improvement. It is based on research conducted by Dr. Jean-Louis Denis and Ross Baker, examining high-performing health systems. And the aim of their investigations was to identify the essential elements to successful health system change and transformation. Quality improvement efforts have been around for a long time, but as we all know, they often are not well sustained or spread. And there are many reasons why improvement efforts fail. To understand why some transformation efforts are successful, CFHI reviewed 3 internationally recognized examples of high-performing healthcare systems. While all 3 used different methods, the analysis found common themes in their work. Those 3 organizations are South Central Foundation in Alaska, a vast primary care system for the Alaskan Indigenous population, the Untitled County Council in Sweden, and Intermountain Healthcare in Utah. They identified 6 key leaders needed for successful change. Focusing on population needs means understanding the population you serve, and that usually starts with conducting a needs assessment of your catchment area. This will enable your organization to provide the right care at the right place and at the right time. Engaging your healthcare providers and frontline managers to collaborate and become agents for improvement helps build a culture committed to providing better care, better health with better value for money. Building capacity and self-reliance for improvement within your organization means training staff in healthcare improvement, giving them the ability to identify necessary improvements based on evidence through clinical and administrative data and by searching the literature, and supporting them in implementing these changes and recognizing them for doing so. Another lever relates to creating supportive policies and incentives. And that means implementing organizational policies that ensure a healthy workplace and support employees to acquire and use improvement skills. Engaging patients and families can drive quality improvement and enable your organization to tap into a wealth of ideas and knowledge about the design, delivery, and evaluation of services. And then finally, promoting evidence-informed decision-making means ensuring that healthcare providers and their managers have access to up-to-date information and are trained in finding, assessing, adapting, and applying data and evidence for improvement. And CFHI, through the research work that was done by Drs. Denis and Ross Baker, have not only developed that framework, but there is a self-assessment tool that you can find on the CFHI website that would allow you to evaluate, have your own team sit down and evaluate where you are even before you start the program, vis-a-vis strengths and gaps relative to the 6 levers for healthcare improvement. Next slide, please. The EXTRA program is divided into 4 modules, each with specific objectives. Module 1, as was mentioned, is in June, and during the 3.5 days of that module, we focus on teamwork and how you are conceptualizing and defining your improvement project. You receive feedback on your aim statement, and you learn how to develop a driver diagram or logic model to explain your improvement project. Module 2 is focused on refinement of your improvement project and health system transformation. So there's we're working at 2 levels. One is really trying to make the final changes to that improvement project. So that's really some micro workshopping that occurs over the first couple of days. And then we switch gears and talk at about the 30,000 feet level around and give you a number of case studies to examine on health system transformation, as well as a policy form that we offer during that module. The third module is when your implementation begins. That's right, follows right after Module 2. And Module 2, by the way, is 5.5 days, all in person. And then you go back to the ranch and start your implementation. And throughout Module 3, which really is, there's no face-to-face time with the fellows, but there are a series of webinars on a range of different topics. And as well, during that module, you are providing an update through a webinar format on where things are, having just started your implementation. Module 4 focuses on sustainability and planning for spread, and that begins in February and runs really until the end of the program. But there is a face-to-face session in February and then another one in June when you come back and do your final reporting. The bubbles or the circles on this slide show some of the types of modalities that we use across the 14 months. So as I mentioned, webinars is a key part, as well as the face-to-face workshops. There are also some aspects that are self-directed learning, and there are different types of online tools and activities that we provide. Some of the, and one of the key areas of rolling out and supporting you throughout your implementation and throughout the development of your leadership skills over the 14 months is through dedicated coaches, and I'll come back to that in just a couple of minutes. Some of the content areas are also shown there in a box called curriculum topics. These are just a few of the content areas or streams that make up the curriculum. There are many more content areas that we focus on as well, though. Leadership development, value-based healthcare, health system transformation, engagement-capable environments, joy at work, organizational culture, and design lab innovation. And case studies are another modality frequently used in the in-person workshops. And on the far right, you will see some of the key deliverables from fellows that start with, at the beginning, and again, that's really in Module 1, examining the evidence that you have brought forward to justify why you are looking at this problem and the justification for the particular methods that you think would be effective. You also begin the construction of your driver diagram, and that will go through multiple iterations, especially over the first 5 months of the program. And you're also developing your measurement plan. At various points after Module 1, between Module 1 and Module 2, you'll send in updates in each of the face-to-face workshops. The fellows themselves, each team has responsibility for providing specific content related to your project and where it's going at that stage. There's an organizational assessment tool that's done just prior to the site visit, and then that's discussed when that site visit occurs with your coach, CFHI staff, and your executive team, as well as your project team. And then, as I mentioned, there are project updates and a final project report and presentation that occurs. Next slide, please. These are the folks who populate our advisory council, and they are wise leaders from all across the country. Terry Sullivan is the chair of the advisory council for the EXTRA program. And he's also a faculty member. Jean-Louis Denis is a professor at University of Montreal. Christina Kraus is the Chief Executive Officer of BC Patient Safety and Quality Council. Martine Couture is a former CEO of one of the health networks in Quebec. Chris Hayes is the Chief Medical Information Officer at Trillium. Sarah Downey is President and CEO at the Michael Garron Hospital. Myself, I work as a consultant now, as a former chief nurse executive. Armand Boudreau is the lead for the coaches and is a management consultant. Tracy Waslick is the chief program officer with Alberta Health Services. And the last member is Marianne Darpino, who is senior director, patient safety with CPSI, patient safety improvement and capacity building. Next slide, please. These are the lead faculty for the program. CFHI faculty members are renowned Canadian and international experts and organizational leaders who have extensive experience leading healthcare improvement initiatives. Typically, they advise CFHI on program design and curriculum development, deliver the curriculum, identify opportunities for shared learning between organizations, provide advice and counsel to improvement teams. They are also available for consultation during each of the in-person workshops that occur. So that's modules 1, 2, and 4. The faculty and the coaches are available for consultation with the team to help you sort of just integrate and synthesize some of the information that you've heard throughout the day. Next slide, please. Each team has a dedicated coach who supports the team throughout the program, and this is really one of the key strengths of the extra program. The coaches are senior health system leaders selected for their extensive knowledge and experience leading health system and improvement initiatives. These coaches work hand in hand with the improvement teams, providing advice and guidance on the design, implementation, evaluation, and promotion of your improvement project. But as well, they really help you focus on the organizational and policy context of your regions and looking at how you as individuals and as a team can help move your organization forward and further build your capacity for quality improvement and for health system improvement. The coaches also provide insights on strategies to gain momentum and support for the improvement project. Our coaches are Roger Paquette from Quebec, Christina Kraus from BC, Marcel Villeneuve from Quebec, Murray Ramsden, BC, Rochelle Bard. Well, Rochelle lives in a couple different places, but I think primarily New Brunswick, and Armand Boudreau, who is also from Quebec. And Armand is also the lead for all of the coaches, and he is the lead for Module 3. Actually, I forgot to mention that the lead for Module 1 is Chris Hayes, the Chief Medical Officer at Trillium. I'm the lead for Module 2. Armand is for Module 3. And Jean-Louis Denis is the lead for Module 4. And now back to the moderator.
Thank you, Patty, for giving us a better idea of the program. I'd like to remind everyone that Patty is staying on the line, and if you have any questions for Patty, please type them in the chat box and we'll get to them very shortly. So now I'd like to invite Corey Bean, our current extra fellow, to give you an idea of what participating in the program entails. Go ahead, Courtney.
Hi, thank you, and welcome everybody. It's my pleasure to tell you a little bit about my experience as an extra fellow in Cohort 15. So my name is Courtney Bean, and I am the Director of VHA Home Health Care. And just in brevity, I'll tell you, our project is working with, we're 3 separate organizations, 3 separate entities that have come together to work on an initiative together, which is a novel approach coming into the extra program. Next slide, please. So I want to teach you a little bit about my journey from my experience in the application to the program, my experience with the program, and just, a final quote that to me really resonates with my experience to date. And remember, we started the program as of 2019. So when it came, so I, like probably many of you, I did not know much about CFHI at the time when I applied to the program, and in doing the what was originally a pilot that we wanted to move on to a full-fledged program, the CEO of one of the 3 organizations, who is a past fellow of the extra program, suggested we consider doing it through the extra program and really lead some quality initiative improvements as part of the kind of partnership that we have with them together. So as we looked into the application, going about it, it was really intriguing. We really did feel that this was a quality improvement method that would help drive it from a pilot to an ongoing program. So ultimately, the decision to do it was a decision that each one of the members of our group had to decide, Can we handle it? Can we not handle it? Do we want to do it? And we did it for ourselves to move this program. The fear, and I'm sure you have, is how you're going to fit this into what is probably an already busy schedule. So I know for me, the thought was I'm involved in and work across half of the province. I'm in many tables, many initiatives. How am I going to fit this in? Where is it going to fit in? And the reality is, it is hard work, so it isn't easy. And so will you find a way? However, yes, you will. And the surprising difference for me is that it's been an evolution from the initial squeeze it in when I can to making sure I allocate time to devote to it. It actually has been an exciting initiative. It's kind of driven our quality improvement in a way that has made me excited to kind of block time in my calendar on a weekly basis to make sure I'm dedicating it to the methodology of CFHI and the extra program towards the project. So where it started off as off the side of my desk and squeezing it in my evenings, it has evolved to being something that I look forward to blocking time in my calendar. And I can speak on behalf of the other members of my team who have all done the same thing. We've done it at certain times to be able to meet all together, since we are 3 separate organizations, but also to do work on our own as well. So I can speak on behalf of the entire group that we've all kind of found this excitement in doing the program that has really brought this to the level that any quality improvement initiative should be within your organization. Completing, I have the first test of teamwork was completing the application, and I'm going to highly recommend that as you do your application that you identify a point person. It's quite a bit of information that you need to provide, and having one person who is making sure that everyone gets their stuff in when it needs to be in and kind of puts it all together, making it sound harmonious, I think is a really important piece. What we did have a project lead involved in getting all of our information and putting it together to submit. If you don't have that individual, find the member of your team who is the most organized and will keep everyone on task to make sure that all their bio information, everything you need to put that application together is together, and before you get a final read from all the applicants. So I really, really think that is really important, and it kind of starts to shape some of the roles of the members of your team before you even start working on your project from the extra scope and direction. So I called it, our kind of first project plan was our application, because it really helps in kind of setting the time frame, getting things done, getting things in when they're supposed to be in. Next slide, please. So some of the overall key points that I want to raise about the program is, one, don't underestimate that there's work to be done. So there is work to be done. But as I said before, you'd be amazed at how the excitement generated from the work that you do. So it is a really, really amazing amount of learning that you take away. And that's why I said rest up before each one of the in-person sessions. So the in-person sessions are an amazing time to learn, but they are full days. And at the end of every day, I walk away, I want this to marinate. I want all this information to seep into my brain and stay there forever. And so you want to really get there refreshed and ready to learn, no matter how many days it is. And you want to also have fun when you're there. And this goes back, this will go to my final quote, but you're working with an amazing group of individuals from across Canada. So you want to be able to make sure that you can have fun in the evening with this cohort that you're part of, while during the day, learn as much as you can from the brilliant people you have in there teaching you and driving the work you're doing. So that leads me to why you need to really enjoy the session. Like, I walk away from there thinking, wow, this has been an amazing few days. I'm tired, yes, but it's been an amazing few days of staying. Some of the pieces around the work feedback and lots of feedback to help really drive quality improvement. It really helps you stop and think. And so often when we do quality improvement initiatives, we try and get them done as fast as possible. And it's really nice sometimes to be slowed down a little bit, to think process and to think, did you think this through? Did you have the involvement? What did your patient advisors think? So to get some of that feedback is really, really, it's rich feedback that really helps to drive a quality job. And it also reminds you at times to celebrate. So the feedback isn't all doom and gloom and things that you have to improve on. It's also reminding you the things that you've done well and how to celebrate. And if you're like me, sometimes there's so much to do that you forget to do that celebration at the end of a good job. The final piece that the instructors had pushed hard for was that you get to know your cohort colleagues. And until you do it, you can't understand why. But you are in a cohort of really amazing individuals with amazing experiences, amazing backgrounds that are some very similar, some very diverse. And this is going to be the group of people that you're going to touch base with in the years to come around subsequent quality improvement initiatives. So to get to know your future national colleagues really, really is a valuable experience. And this is what led me to the next slide. So next slide, please. Well, my quote is, I've always wanted to live in a neighborhood with you. And so I took that from Mr. Rogers, and it was kind of fitting because the Mr. Rogers movie had just come out at the time of putting the slide together. But what I'm trying to really impart is that you are going to become part of this national neighborhood of experts, I'm going to call them, experts in their own area, but experts in quality improvement. The instructors, the coaches, like it is such an honor to learn from them and to have the information they impart and to have the ability to reach out to them in the now and in the future around quality improvement initiatives, but also your colleagues from either your cohort or cohorts before you who are going to be part of your neighborhood from a healthcare improvement or even if from ministry or from other areas, but from a quality improvement perspective across Canada. So I strongly recommend the program myself. As somebody who went into it, not knowing a lot about it, I feel like I've grown exponentially as a result. So thank you.
Thank you, Courtney. That was a great presentation. And I want to remind everybody that if you have questions for Courtney, Courtney is staying on the line, and you can type your questions in the chat box. I will go on. Before I go on to explain the application process, we did get a question from Kathleen in BC, who did the BC Quality Academy and is wondering how this relates to EXTRA. It is, the EXTRA program indeed is a team-based program, as we explained, and QI. Kathleen, our program is also a pan-Canadian program. We do have fellows who have completed the BC Quality Academy program, and we do have one in the present cohort, and we would be happy to link you. So if you want to send us an email, we'll give the email address, and we can certainly put you in contact with this fellow, and I think that would be the best way for you to learn more about our program versus that one. And thank you so much for your questions. Okay, so I'll move on to the application process. As we've been mentioning, the EXTRA program is a team-based program, and so there's a few members of teams that we want to point out. So each team needs to identify an executive sponsor. Often that executive sponsor is the CEO or a senior leader in an organization. And that person provides basically leadership and executive endorsement and support. And this is quite important and will greatly help the teams and the improvement project to have that executive support throughout. So things that we expect from the executive sponsor include not only giving the support, the strategic advice and guidance, but they would participate in advisory meetings and our CFHI site visits and coaching calls, some coaching calls. They ensure that the team is given protected work time to work on the improvement project. They ensure the team has access to the resources, the required resources to be successful. And we do ask that they co-present during some progress report webinars and that they attend the final presentation. The core team, so the core extra team, this is a team of the 3 or 4 fellows, and we ask that the team appoint a team lead who is the primary point of contact between us and the executive sponsor, also in the team. And the team lead should also plan to provide the guidance and oversight to make sure that the milestones are met. So the teams can be comprised of organizations, different organizations. You do not have to come from a single organization, and it can be multiple sectors. So the team can be formed of people working all in healthcare, but it could be healthcare and education or healthcare. And one of our teams this year is addiction team, people working in addictions and people working in the justice sector as an example. There is an implementation team to think about. So your core team is the 3 or 4 fellows, but for the project, you're going to need more people to help to be able to carry out the project. So you form a larger project team and you identify experts within your organization that you use as needed for consultation or extra support. So you may ask some clinicians or frontline staff, so a patient safety quality improvement advisor, somebody in policy, and maybe some representative from community organizations you work with. So basically, you need to think of a larger team that will help with this improvement project. We do expect that there will be a patient family member that will be part of the larger implementation team. We actually ask you to identify 2 patient partners to be part of the team. Your applications must also demonstrate that you're going to receive guidance from an advisory group and that you have identified some key stakeholders. So we recommend the thought while you're putting in the application together of putting together an advisory committee and the stakeholders. We offer pre-application coaching calls. So from tomorrow until February 5th, 2020, you can email us at the extra address on the slide there, and we will help you. We will guide you through the application process. So we recommend that you bring your executive sponsor to the call, and we can help you scope the project, assembling the right team. We make sure that the project is aligned with the priorities, and we will, again, talk about stakeholder engagement and partnering with patients during that call. The calls are free, and we are happy to schedule those. And like I said, just send us an email, and we will organize this for you. The deadline for applying is February 11th, and you need to email us to get the application form. So that email address that's up on the screen comes up often. But if you're interested in applying, send us an email. We will send you the application form. And once after the deadline, our advisory committee forms the merit review panel, and we will select the applications. Now, we will do a screening of your applications, and we will work with you to ensure that the application is filled out correctly. So there's a few steps. As we said, we strongly recommend a coaching call, but also once you've submitted your application, we will do a review here at CFHI and ensure that all sections are filled out correctly before we bring them to the review. We will decide on the teams by the end of March, so you should hear at the end of March, early April, whether or not your team has been selected for the next cohort. So something new this year during the merit review is that we will ask you to come and participate in a 7-minute interview. You do a 2-minute pitch about your team and your improvement project, and then the other 5 minutes are panel members asking questions, just so you have an opportunity to clarify parts of your application and ensure that everybody's got a common understanding. So the fees. The fees are $5,000 per fellow. Okay, so per fellow, so a team of 3 is $15,000, and the organizations pay a one-time fee. What does that fee cover? That covers the travel to and from the in-person workshops, the accommodation, and 2 meals per day at those workshops. It also covers the access to the faculty, the coaches, and the online learning platform that we use during the program. And obviously, organizations are encouraged to cost share, but those are the fees to join the program. Now, there's a question about how many teams are selected for each cohort. Typically, it's around 10. We don't have a definite number, but it's around, we aim for about 10 teams. The next slide that's up now is just a reminder of key dates and milestones. So we've gone through a lot of these dates already during the presentation, but they're there for to refresh your memory. And as this presentation will be available on our website, you can refer to this slide for the key dates. So as I mentioned, both Patty and Courtney are still on the line, and we can open up, if you can type your questions in the chat box, we can get Patty and Courtney to answer some questions. Now, during when you registered for this webinar, there were some questions submitted, so we can address some of those questions while you're typing if you have some questions. So one question we received was, how much medical expertise is required or expected for individual participants? And it's none, as we mentioned. We're looking for senior leaders in health or social services. And so there's no medical expertise required. There's a question about engaging physicians to practice change. Basically, some of our teams, I should say, have physicians on the team, and this is something to consider when you're thinking about your improvement project, whether or not having a physician on the core team is really going to impact, is needed for your project to move along. If not, maybe the physician is required on a larger implementation team. But this is project dependent about just engaging the physician. But as I said, we have a few physicians in the current cohort that are participating. One is about the Certified Health Executive Program that's offered with the Canadian College of Health Leaders. Somebody asked, they're currently enrolled in the program and they're almost finished. The extra program is considered, has been mapped to the LEADS framework, and therefore if you're applying to be a certified health executive through the college, the extra program will cover the LEADS part of it, the education, and the project will also be recognized as the project you do for the certified health. So therefore, what you would still need to do to get your CHE designation after completing extra is the 360 assessment that they ask and a development plan that they ask. And the question we just got, I'm not seeing any specific areas of focus or objectives within where the projects must fall. Is that correct? No, there's no, basically what we do say is that your project should align with the strategic objective of your organization or provincial strategic objective, because that will just get that support that you need to be able to complete it. A definition of senior leader, is it title-based or scope of responsibility? We like to see it as scope of responsibility. And each team should have at least one member that has that scope of responsibility. We truly believe that is a factor of success, and that was one of the questions that was asked prior to the webinar. What is a factor of success for extra? And having that executive support and a senior leader within the team, we would say is one of the factors that really helps support. Another question we've had is how are the unique issues and context of making improvement in an Indigenous healthcare setting addressed during the program? And this is, we just want to say that this year in Cohort 16, for the first time, we will have Indigenous coaches. So representatives, 2 coaches, one from a First Nations community and a Métis coach, that will work with all the teams to ensure that your projects are considering the unique issues to Aboriginal populations. And we are also building our curriculum and reviewing the curriculum to make sure that we bring throughout cultural safety and humility and unique issues throughout the curriculum this year. We, just to add to that, we don't propose even though we teach some mainstream QI approaches, we're not going to ask you to use a certain approach. So therefore, there are flexibilities to adapt those QI approaches to meet the needs of the population you're serving during the program. Okay, let's see. I'm not sure if Patty or Courtney want to add anything, or if there's any questions.
So hi, Courtney. Can everyone hear me? So regarding the question around physicians, and so we are a team where we do have one physician as a member of our team. So once again, it depends on what your project is, whether or not a physician on your team is beneficial, or just having physicians on your implementation team is enough. For us, it has really been beneficial having our project, which is dealing with 3 separate populations over the course of our time in extra. Having that physician lead to help kind of champion the physician buy-in from different areas from the acute care sector has been really beneficial, but it could have been done through the implementation team as well.
Thank you, Courtney. Go ahead, Patty.
I see another question here. That has come from Tiffany. Do most teams apply for ethics approval, both as part of Extra and locally? No, the majority don't, but it really depends on your initiative, how you're shaping your improvement project, as well as what your own organization's policies are in terms of ethics approval. So that's the kind of thing that CFHI can provide very helpful advice, and it's a consultation telephone call with your team. But the majority of the teams do not end up going for ethics approval. Sometimes we have teams who are, in addition to Extra, are also applying for grants to help increase the funding for their initiative. And if that's the case, that there's a research focus on the project as well, then usually, yes, they are going for clinical ethics approval inside their organization. But again, the majority of the teams have not needed to do that.
Thank you, Patty. I'm not seeing any other questions, and I believe, there's just a question that came in. Does CFHI have a database bank of individuals who can provide support to organizations seeking a senior leader or committee member because of time restraints of busy organization members? So if I understand the question well, I think what I would suggest is to send an email to the Extra inbox, the email address we've been given, and we could organize a call, because this would be something we would address in the pre-application coaching call, and trying to help you really to give you some ideas of how to work around this. So again, even if you have questions that come up to you in the next few minutes, that email address that Jessica just put in the chat box, please send those questions and we will answer them. We will follow up with you. Before we go, I just want to thank Patty and Courtney for their presentations today, and to you, the audience, for the participation. And I hope it's been helpful to explain the nature of the Extra program, and that this might spark a dialogue in your organization about a healthcare or an improvement project and submitting an application. And now, before you go, there's going to be a few questions on the screen, and we would really appreciate your feedback in answering them. So the question, would you be interested in submitting an application for the Extra program? I'm interested in setting up a coaching call to learn more about the application process and requirements. Can we contact you further to discuss the Extra program? And here's another opportunity to let us know of other questions we can address for you that will help you decide if Extra is a good fit for your program, for your organization, sorry. So once again, thank you to Courtney and Patty, and thank you to Kelly and Mihaela for the work they do behind the scenes running this webinar, and to Jessica that helped moderate the chat. And again, thank you for joining us today, and a reminder once again that you can email any questions, you can email for extra information, and also that this presentation will be available on our website in a few days. Okay, thank you very much, everybody.
This concludes today's webinar. Thank you for your participation. You may now disconnect.